In a significant step toward advancing sustainable healthcare, over 50 experts from more than 18 countries gathered in Ulaanbaatar on Monday, September 16th, for the start of the inaugural Global Technical Training on Climate Smart Health Systems. Organized by UNICEF with support from the Government of Canada, the event is focused on two critical areas for healthcare facilities in Mongolia: waste management and solar electrification.
I'm really honored to be speaking.
Health systems worldwide are significant contributors to emissions and local air pollution. A 2023 UNICEF study revealed that the burning of healthcare waste is the largest source of carbon emissions within immunization programs, accounting for 28% of the total. In contrast, the adoption of solar electrification in healthcare facilities has been shown to reduce emissions by up to 25%. World Health Organization has reported that around 30% of healthcare facilities globally lack proper waste segregation systems. In the least developed countries, fewer than one-third have adequate systems for safely managing healthcare waste, especially in the wake of the COVID-19 pandemic.
Just after COVID-19 and during COVID-19, we have seen that there's a lot of waste piling in most of the hospital. After many intervention and many use like a PPE, like syringes, and many other items for the hospital are piling. It's not well controlled. So we have done a study with the Ministry of Health of Mongolia to see what are the best way we can ensure that those wastes are well managed. And based on that, we have developed a specific action plan with the ministry in terms of the equipment need to be procured, in terms of capacity need to be built, in terms of infrastructure to make available to receive those equipment that we need to provide. So based on this analysis that we have done, we have, together with Ministry of Health, procured 51 units of medical waste management that we have started implementing in all the healthcare facilities in the country. Those are cutting-edge technology, very good in terms of managing the biomedical waste, and then basically can be mixed up with the domestic waste, which is a very good development for the country. So this is one side. And then the second side related to energy in healthcare facilities. We have seen after the COVID and then the situation that Mongolia is facing in terms of country in the middle of the big two giant country where energy is playing a lot of game around that. We have seen that having more independent, also having a solar system in some of the healthcare facility will help maintain the cold chain in most of the healthcare facilities. So we have started working on that.
Canada is the fourth largest donor of UNICEF globally. We fund UNICEF to deliver the programs to protect children and provide services for children throughout the world, in specifically 150 developing countries, but also we provide funding for emergency support throughout the globe. And the funding for this particular training comes from that global support that we provide to UNICEF. And, combating climate change and mitigating the effects of climate change is very important for Canada. It's one of our top priorities. And we do that in many different ways. We provide multiple different support to combating climate change, including in better management of the healthcare services. As I mentioned in my speech, healthcare services normally saves lives, but they also generate a lot of waste. And it is important to develop protocols and procedures on how to manage those waste to be able to prevent any environmental pollution, because these environmental pollutions could cause more damage to people's health than we think. And so it's important for us to support training like this that can provide some lessons learned and some coaching and procedures on how to better manage healthcare services using green technologies to improving the efficiency of managing that waste.
A United Nations General Assembly resolution adopted in 2023 underscores the urgent need for climate-smart healthcare systems. Addressing environmental risks, including hazardous healthcare waste, is critical, as World Health Organization estimates that improving these conditions could prevent up to 26% of deaths in children under 5. Sustainable Development Goal Target 3.9 aims to significantly reduce deaths and illnesses from hazardous chemicals and pollution by 2030. This landmark training event in Mongolia marks a pivotal moment in the global effort to implement and maintain climate-smart healthcare systems. Participants were equipped with the skills and knowledge necessary to adopt and update policies, enhance expertise in green and safe healthcare waste technologies, and deepen their understanding of solar electrification for healthcare facilities. As countries strive to meet ambitious sustainability goals, the insights gained from this training are expected to drive sustainable progress in creating sustainable, environmentally friendly healthcare systems worldwide.
I'm really honored to be speaking